In order to ensure that Tanzania is free from malaria, the National Malaria Control Program (NMCP) under the Ministry of Health, Community Development, Gender, Elderly and Children has been distributing insecticides-treated nets through mass replacement campaigns. This has been done for the past 5 years.
Recently, we have been conducting different interventions focusing on prevention of malaria, but also treatment of malaria and the monitoring and evaluation of the malaria program. So in the area of prevention, we deploy different interventions, this including the distribution of treated mosquito nets to the communities, but also in health facilities and also in schools. Our main aim is to ensure that every household, every person has an access to ITNs, these mosquito nets.
We've been doing mass replacement campaigns since 2016 and 2017. And during that particular period, we did the mass replacement campaign in all 26 regions and all 184 councils. But this time around, in this MRC which we are implementing, we are only doing it in 10 regions and 50 councils.
Mstari wa kwanza zitakuwa 30, zitimie 30. Mtendaji, Vyandarua ni hivi hapo tumeshavishusha, ambayo oda yetu ilitufikia Vyandarua 871. Kwa naomba nikakukabidhi afu uje usaini kwenye hizi nyaraka zetu.
These treated mosquito nets are going to help us in the campaign against malaria.
Ndugu wananchi, kesho ugawaji wa Vyandarua, ugawa Vyandarua kesho, wananchi wote mnaimika mtoke. Mapema saa 1 ofisini mfike.
Wanaonyonyesha, wakina mama wanaonyonyesha.
Naishukuru serikali kwa kutuletea neti katika kijiji chetu Mayaha.
Napenda kupongeza MSD kutuletea Vyandarua moja kwa moja kwa jamii.
Ujio wa neti hizi utatupunguzia gharama ya matibabu, kwa sababu umbu walikuwa wengi wanatupiga gharama nyingi.
Lile eneo ambalo limetupa changamoto ya barabara kama mnavyoona hapa, gari haiwezi kupita.
In May 2020, the National Malaria Control Program under the Ministry of Health launched the 2020 Mass Replacement Campaign (MRC). Due to MSD competence, experience and its strength in the health commodity supply chain of Tanzania, it was then commissioned to facilitate distribution of more than 7 million nets to 50 selected councils in 10 regions of Mbeya, Njombe, Songwe, Rukwa, Iringa, Singida, Dodoma, Manyara, Tanga and Kilimanjaro.
Implementation of MRC, we have commissioned a medical store department to do it. And this is because, first of all, is the institution of the government trusted institution of the government. That is one. But again, MSD have capacity and efficient logistic to do mass replacement campaign. So we were very much comfortable that if we give this activity to MSD, they will do it efficiently, and we are sure because it's the institution of the government.
How is MSD committed towards efficient distribution? Marco Masala, the MSD MRC project manager, explains.
The MRC supply chain management with all related transactions are being done through MSD electronic platform. With such endeavors, MSD has made tremendous achievement, which have demonstrated the MSD's competence and strength.
What were the main preparations? Mr. Masala once again explains.
The first thing we did is to design the so-called MRC supply chain management, followed by lighting the MRC guidelines. The MRC supply chain management covered the MSD's scope of work in this project, which involved the activities of receiving mosquito nets from A to Z, with the manufacture of the said mosquito nets, storage and distribution.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Basi note hapo. Kwenye gari lilokuepo hapo nje.
How did they get to reach all the villages in the said 50 selected councils in those 10 regions?
We started with doing the route mapping, whereby we identified the type of trucks that are required to move nets from MSD to the issuing points, the number of staffs, and also the number of routes to be undertaken. So then after the route mapping, we did a pilot start in the Mbeya region, whereby our aim was to test our plan by identifying areas where it needs improvement.
Doroth Mtatifikolo is the MSD software developer who was engaged in the MRC project as an ICT expert. Here she clarifies all the systems which were used.
We have 5 systems that we are using to support MRC project. Number 1 is MSD customer portal. Number 2 is EPICO ERP, Enterprise Resource Planning System. Number 3, we have MSD Proof of Delivery mobile application. Number 4, we have CRDB bank application, omnichannel for payments. And the last one is MRC MIS.
But how do stakeholders access data?
Well, stakeholders access data through MSD customer portal, which is a web-based application. It helps all the information that are captured through MSD POD.
We were also interested to know, how do they know the quantities for each ward?
Our main task was to receive LLN requirements and process them through E10 system. After processing all the issuing point requirements, the next step was to hand over all invoices and the other related documents to team leaders for field use. Another task was to receive LLN proof of delivery documents from issuing points. Thereafter, we were required to verify them and finally file them for future use.
How do they manage to reach all the villages during distribution?
The task also included communicating and sending physical proof of delivery to National Malaria Control Program and the district executive directors. We also had call center service, which was responsible for notifying all stakeholders before and after LLN delivery to the issuing points, as well as receiving feedback of the entire exercise.
Before going to the field, the team consumes registration data, export them to Excel, and consolidate registration data per districts. Then the consolidated registration data is sent to the sales office for order processing.
Hapa tunazungumzia hapa hii na huyu hapa. Mbona hizi kuna shida hapa? Afu hii imetikiwa, yeye imetikiwa ni haya. Nini kondoa TC, kondoa DC.
Now ready to go to the field. Here the team leaders Hassan Ali and Samuel Kamugisha tell us how do they manage their roles to be successful.
Before the commencement of the actual distribution in the field, we normally conduct what we call the pre-arrest meeting. And these meetings involves all key stakeholders within the region and the district. And these meetings are led by the district and regional commissioners. And some of the members of these meetings are the CHMT, who deals with MRC operations within the district and region, but also the district and regional security councils. Within these meetings, we always discuss about the data issue which has been received in MRC, from MRC MIS system into our system as MSD, which is MSD Customer Portal. As we have discussed, as we discussed those data, we came to a common agreement that there should be data cleansing in order to ensure that the MRC MIS system and MSD Customer Portal speaks the same language.
Before going to the field team would normally notify the customer service team that we are ready to go to a certain district. The customer service team through the call center would send text message to all village executive officers that MSD are coming to bring the LLINs.
How do they manage data accuracy?
Now this field team perform different tasks. So we have several individuals who have been assigned different tasks.
That was report writing unit. We were dealing with the report writing and preparation of reports. There was a day report, a weekly report, and monthly report. The report conveyed information of the distribution to the issue points.
Tulikuwa tunahusika na uandaaji wa malipo.
We are full involving in preparation of payments, including ward executive officers, village executive officers, casual laborers, and temporary staff who were involved in distribution of nets.
We had an IT department where our great task was to support our fellow staffs concerning any network issue and any technical issue, who were working in the office and those who were in the field. Apart from that, we are making sure all the invoices that we have been seeing them on the system, and also keeping all the record on MSD server.
Kwenye mradi wa MRC kulikuwa na kitengo cha usafirishaji. During the implementation of MRC project, we had a transport unit. Our duties were to oversee all activities which concern with transport from MSD warehouse to the issuing point.
We had a warehouse team responsible for receiving, storage, and dispatch of the mosquito nets.
We have also an individual who manage daily communication between the field team and those village executive officers.
As we are executing the MRC project, we are encountering a number of challenges in the field and off the field. But the big challenge that we encounter, we as MSD, is an issue of partial registrations. You might find that we have done with the distribution in a certain district or region, but we are then hereby recalled back for another round of distribution. And it becomes a challenge, since as we go back, sometimes we can take one bale, 5 mosquito nets or 3 mosquito nets to several kilometers, like 100 or 200 kilometers.
Katika zoezi zima la usambazaji wa vyandarua vya wananchi tulikuwa na changamoto nyingi sana, lakini changamoto mojawapo ilikuwa ni namna ya uwezekano wa kumfikia mteja wetu wa mwisho. Hii ni pamoja na miundombinu, barabara kwamba zilikuwa hazipitiki kwa muda mrefu, yani ile flow movement ya magari ni ndogo, kwa hiyo barabara zingine zimepotea, kwa hiyo mara nyingi hata mwelekeo unakuwa ni mdogo. Kwa hiyo tulijitahidi na hasa kushirikiana na wananchi kuwauliza njia, direction, lakini tatizo linakuja kwenye lugha sasa. Wengi wanajua kilugha, hawajui Kiswahili. Na hii ina maana kwamba ilibidi tulazimike kujifunza lugha angalau hata ile salamu. Mwangaluka. Akipay attention hiyo, basi unasogea pale, unamuuliza hata kwa vitendo, ili akuelekeze sehemu hata kwa vitendo. Na kweli kwa staili hiyo tuliweza tukafanikiwa kwa hilo, tukafikisha mzigo wetu katika eneo husika. Alikuwa na changamoto nyingine ya maradhi, kwa mfano maji, mnaishiwa maji ya kunywa, chakula, mnafika sehemu hakuna mgahawa, hakuna hoteli.
Huwa tunatumia mfumo wa GPS kufika katika maeneo tuliyopangiwa kufikisha vyandarua, lakini tunafika katika maeneo ambayo ile mfumo wa GPS unakataa kusoma kabisa, yani kila tunavyojaribu mfumo unakataa. Hivyo tunalazimika kuwatafuta wanakijiji wanaozunguka yale maeneo ili watupe picha halisi ya kuyafikia maeneo tuliyopangiwa. Lakini cha kushangaza na kusikitisha, wale wanakijiji wanakimbia, wanajificha chini ya vichaka kwa sababu hawajawahi kuona magari na wanatuogopa.
Changamoto unayokumbuka ni ya kusafiri ndani ya maji zaidi ya masaa 12 kuvifikia vijiji vilivyokuwa kando kando ya ziwa Nyasa.
Kuna wakati tunaenda vijijini, lakini wale wananchi wanatuelekeza kwamba barabara ni nzuri na zinapitika kwa urahisi, lakini kiuhalisia unakuta barabara ni mbovu na hazipitiki. Unafika katikati unakuta barabara ni mitaro, madaraja yamekatika, yani hadi kufika kwenye ile position ambayo tunatakiwa tufike inakuwa ni shida kubwa.
Tunapopanda milima mikali tunakumbana na kigongo kikali, mawe yenye ncha kubwa mpaka yanasababisha tairi kubomoka, kupasuka. Hapo nakumbana huku kulia na kushoto, huko katikati, huko kulia kuna bonde na kushoto kuna bonde. Hapo sasa unaanza kujiuliza, je, nitafika nako kwenda?
During the completion of physical handover process, it required signatures and other important information for documentation. The team faced challenges in some stages.
Sometimes we meet village executive officers who are not capable of executing duties of the village executive officers, of which we need to request their supervisors to assist.
Kuna baadhi ya maeneo hupendekeza kushushia vyandarua eneo tofauti kutokana na usalama zaidi. Mara nyingi hupenda kutumia shule au vituo vya afya. Hapa uhitaji uthibitisho maalum ambao tuna fomu maalum ya kuthibitisha eneo la kushushia.
The village executive officers had their views regarding this MRC campaign.
Mnamo mwezi wa 7 mwaka 2020 tulipokea taarifa.
In July 2020, we were informed on the mosquito nets distribution exercise from the regional health facility team. We were expected to prepare 4 clerks to attend training. After training, we were registered in the MRC Zero Malaria electronic system to our phones and coupon booklets which were used during registration, particularly in capturing details such as name of the head of household, gender and number of nets required.
Kwa sababu wananchi hawana uwezo wa kumudu gharama za kununua vyandarua kwa nyumba nzima. Kwa hiyo tunapowapatia vyandarua inasaidia watoto, kina mama wajawazito, wazee kupunguza idadi ya malaria.
Napenda kuwashukuru MSD kwa kazi nzuri wanazoendelea kuzifanya. Nadhani kutufikia huduma hii malaria itapungua kwa kasi, na kwa kuwa wananchi tayari wameshapata vyandarua na ni kwa asilimia zote 100. Hivyo serikali kupitia MSD tunazidi kuishukuru.
What about the beneficiaries, the wananchi?
Nimepata leo neti, nimefurahi. Tutazitumia hizi neti vizuri kwa uangalifu, mimi na familia yangu. Wa kwanza Stefano, wa pili Saidi, wa tatu Monica, wa 4 Neema.
Nimepata kinga ya kukosa kupambana na wadudu kama umbu. Alafu nalala usingizi bila shida. Kwa hiyo naona itakuwa nimefurahi kuliko nilivyokuwa natarajia kupata shida kuumwa na umbu.
Nafurahi sana kupata neti ya kujifunika kwa ajili ya umbu na mume wangu.
This program was produced by Medical Stores Department Communication Unit. Thank you for watching.